introduction of Dr. Katie Strand. Okay, starting with name of Almighty, paying honor to our chief guest, Professor Dr. Hassan Sweet, and honorable keynote speaker, Dr. Katie Strand, and paying honor to our very special guests and President and Secretary of Bangladesh Institute for Optometrists, Dr. Katie Strand, a name of adventures in neuro-optometry. Dr. Kathy Strand achieved OD, HCOVD, HCSO, FNORA, is a behavioral neurooptometrist with a private practice near Boston Limited to the diagnosis of behavioral, developmental, and neurological vision problems. She treats patients through vision therapy, syntonic phototherapy, corneal reshaping technology like Ortho-K, and neurooptometric vision rehabilitation. Our current interests include collaborating to design products that enhance visual perception within Innovation Lab, assisting the NORA clinical applications course, and helping optometrists at office-based vision therapy. We're thankful to you for joining with us within your busy life and wishing you a healthy and successful life. Thanks to all, and thank you. Muntu sir, please, you continue then.
Thank you.
Yeah, thank you, ma'am. Alia, maybe technical problem. Sir, Muntakon sir, please continue. Please continue.
Hi, Kathy, we can start the discussion. So I think I'm requesting you first to start with discuss about the what is the role play of optometrist in COVID-19. Then we can start one by one. Please start. Thank you.
Assalamu alaikum.
Walaikum assalam.
So here in the U.S., we've been not practicing for a few months, but in some places, they've been able to stay open for emergencies. And as of maybe last week, most places can now be open. Here, some started, I'm in Massachusetts. There are 50 states, and each state here is different. So I'm in an area where we have one of the highest levels of COVID. So some opened this week, and most are going to open if they want to next week. Some are still waiting. But here, the hard part is that if you have an office of your own, you haven't been making any income, obviously, and you still have rent, and there is an issue with employees, people that work for you, but the government has that some people have been able to get some monies to help with that, but not everyone. But I didn't know how much you know just about optometry in the United States. So here, you have to get a bachelor's degree first. So after high school, we go to college for 4 years, and then optometry school is 4 more years. So it's 8 years. And then it's a doctorate. It's kind of like a PhD. It's a doctor of optometry. And when I was talking even with Rajiv about how we get optometry to be more recognized and maybe do more things, one is I was talking with him about any optometry schools. Like here, all the optometry schools have to be accredited. In other words, there's a body, there's a group of I guess, mostly optometrists. They can say that a school is teaching the right things or not. So what they do is, for example, in the last maybe 10 years, there have been a few new optometry schools, and one of them had trouble for a few years getting this accreditation. And if they're not accredited, uh, students have difficulty with their loans, and it's questionable when they get out whether whether they can practice even if they pass all the exams. So here you have to take certain tests along the way during optometry school, but then when you get out, each of the 50 states has a different law about getting your optometry degree. So for
Hello, sir.
example, I have a license here in Massachusetts, but if I want to
sir.
move to another
আপনারা কি
state,
মেসেঞ্জারে কি করবেন স্যার এই করতে
if
পারবেন
I don't have a license there, then I would have to take probably all the tests I took many years ago all over
হ্যাঁ
again.
হ্যালো
It's not one license. But the big thing in a smaller country would be to have uh, a curriculum, to have subjects that you know are being taught pretty much the same in every school. I mean, I know when I got out of optometry school, maybe I learned some things a little better, some things a little bit less than someone from a different school, but we all had at least a basic curriculum that we had to follow and that we had to learn. And then we had something they called national boards,
Hello.
which were a national test that everyone can take. And then if your state accepted that and some didn't, so you'd have to take another test, then we just had to take a small test on like the laws of that state. And then we had to
স্যার
do
এই নাম্বারটা তো ফোন করে
a
তো
practical exam. So they had us examining a
Essential seven
patient
number
or doing something with contact lenses. But once you get the degree, then in each state, every year, there's a certain number of credits, continuing education credits, that you have to get to keep your license. Some states might not even have any credits you have to get.
পেয়েছো? হ্যালো,
Am I
Hello?
back?
হ্যাঁ
I'm back. Yeah, I think when he muted everybody, it muted me again. Um, So there's a big organization here now that approves a lot of the courses, and they're allowing a lot of them right now to be online because of COVID. Normally, you can't do very many that, you can do a few credits online, but you mostly can't do them online. But they're allowing all that now because of COVID. And when we do reopen our offices, everyone is trying to figure out what they have to do to have everyone be safe. So some people are having people wait outside the office and then come in one at a time. Everyone's wearing masks. Some people have set up like glass in front of, where the person meets them. Many people have put new shields like that in front of their phoropter and in front of their
Hello,
slit
sir.
lamp, so
Hello.
they can
ওই যে আমার এই যে নেট আপনি ইন করছেন স্যার
be
আচ্ছা
more
স্যার আমার
safe.
ওই যে নেটওয়ার্কের সমস্যা হচ্ছে তো সাউন্ড একটু সমস্যা হচ্ছে স্যার একটু হেল্প
Somebody's
করবেন
not muted.
হ্যাঁ লেকচার শুনেন স্যার ঠিক
But
আছে
the big thing here, I think, is that
আচ্ছা স্যার
optometry probably 50 years ago was mostly refraction, contact lenses, some low vision, vision therapy, and then there was a big push um, about that time to start getting optometrists more involved with the medical treatment of eye disease. And so each state had to do it one state at a time. So when I graduated, in some states, I could, for example, dilate someone's eyes. Those are called diagnostic drugs, or I could use a drug to numb the eye for glaucoma testing. But when I came to Massachusetts, I couldn't do it here because we didn't have the law yet. took about 10 years here or more to get that. We were one of the last states to get that. Today, in every state except where I am, we can treat glaucoma, not just diagnose, but we treat. Here we can write prescriptions for some medications, not necessarily oral medications, but if someone has conjunctivitis or a corneal ulcer or something like that, we can write prescriptions, dry eye. But in some states here, they can also um, prescribe other kinds of medications. They can prescribe oral medications, and in some states here, I think 2 states, they can use lasers, which I'm sure will be coming more and more. Massachusetts, I think here where I am, there are a lot of very big medical schools. It's a city, probably maybe second to New York, where there are several very large hospitals and a lot of doctors, a lot of physicians, and it's been a little slower as our education has improved for us to get licensed to do those things because the optometry law didn't include those things in the beginning. So now they have to get our legislature to pass new laws so we can do these things. And that takes a long time sometimes. But it's a good profession here. You can earn a very good living here. You don't get too many phone calls in the middle of the night. And the only problem here is if you're practicing in one state and you have a license, like I'm here in Massachusetts, if I decide to move and it's a state that I don't have a license, at this point, I probably couldn't get one. And that would be, that's harder now because when I first got out of school, I think many people moved somewhere or they went back where they grew up and then they stayed there. But people are much more mobile now. Either they want to move or often they have a husband or a wife who has a job and they have to move for their job. And so that can make it difficult. But in general, optometry in the last, especially the last maybe 10 to 20 years, has really changed dramatically from what we did 40 or 50 years ago, which was that, or even 30 years ago, when we primarily did refractions and fit contact lenses, and then some people did low vision, some people did vision therapy, but we really didn't do a lot of medical treatment or even maybe a little bit of diagnosis. And now there are some optometric practices that are all about medical. They treat eye disease, they follow glaucoma patients, some, they do a lot of more treatment for dry eye. They do almost everything except surgery. And now in a few states, they're going to be able to use laser. So far, I think it's mostly when patients need it after cataract surgery. I don't think they're doing any, I don't know that they're doing retinal laser, but it keeps changing. And part of it, I think, is it's happened more quickly in states where they're more rural because in some places, you can have to go a long way to find, for example, an ophthalmologist or a hospital where you can get these things. And so there are many, many more optometrists who would be available. But where I live, there are many, many ophthalmologists and optometrists very close by. And so they have not, so it's been harder here to have optometry do those things. But I think the first thing really to start with is getting everyone's education up. In fact, here, we've been trying to get the law changed so we could treat glaucoma. The first argument from medicine was that we didn't have the training to treat glaucoma. And so what happened was we decided that we would give the course for treating glaucoma. So I think it was a 90-hour course. So I was going twice a week for a year or something to take this course. And long before we ever would get the law, uh, I did it many years ago because we thought it would be much faster to get the law, but here it's been a bit slower. But we use that to say, well, you can't say we don't know how to do it. We've all taken these courses where we've seen patients, we've actually done it already, um, and uh, and we hope that that would make it happen faster. And it has happened in 49 of the 50 states. We're just the only one that's still a little behind. But that's expanded things quite a bit for optometry to be able to do more of the medical, especially in places where the optometrist might be the only one within, you know, I don't know, many kilometers. It could be an hour drive, it could be a 2-hour drive to find someone. But in the local community, there might be an, and the first part, I think, is the education. To get it to be good, to get it doesn't maybe have to be 4 years, but whatever it should be schools, and there should be a group that oversees that and periodically changes the curriculum or adds to the curriculum. And then I think there should be some requirement that every year an optometrist takes certain courses, especially as new things come along. And we know that some people will sit in a class and not really learn very much, but for the most part, I think people want to keep up their licenses. And so they have to show that they're taking these, these courses. I think it's good. So I know there's nothing real clinical that I'm talking about, but does anyone have questions for anything about what we're doing or how it's different from how it is where you are? You have to unmute.
Unmuted. Do
Yeah.
unmute. Yeah.
What is
Yeah.
the role
Now I
that AOA is taking? AOA is taking on behalf of your optometrists, their members.
Who is going to speak?
Yeah, Naresh here from Sri Lanka.
Okay.
Yeah, what is the role that AOA, American Optometrists Association, is taking on behalf of the optometrists there?
So the American Optometric Association is an organization that we choose to join. And I would say, I don't know the numbers exactly, but it might be maybe 3/4 of the optometrists who join. It's not everyone. In fact, like here, the American Medical Association speaks a lot for medicine. People think all the doctors belong, but only about half the doctors belong to it. But they've like the American Optometric Association has worked hard to be involved not just with helping us more directly, but getting involved with things that require changes in legislation, especially at the federal level here. So we have, the way we have it here is each state.
Kathy,
Want us
just
to
just
join
hold
again,
on.
Rajiv?
Kathy, yeah, I mean, just a second. In a couple of minutes, probably we'll be, the time is
Oh,
over.
it'll go off. Yeah, so we'll just rejoin.
Yeah, just rejoin again back so that we can continue that discussion.
Okay.
Yep.
Yeah. So we're only at 34, so we're good for a few more minutes. So the American Optometric Association has worked hard on a lot of legislation. So here, every state has its own optometry law, but there are also things that happen at our federal level. And if a federal law passes, it supersedes, it goes over the state law. So for example, many years ago, we have here what we call Medicare. Medicare is insurance for anyone over 65 and younger disabled. And we were having difficulty because we couldn't get paid from Medicare because we weren't considered what Medicare calls a physician. And so they worked hard to get us to be considered in that same class as dentists and other physicians, so that we could get paid from that insurance. And that made a big difference because now we could see a lot of older people and they would have their care paid for. And then slowly, for many years, other insurances would pay us either not at all, or they would pay us for refraction, and that was all. They wouldn't pay any of the medical treatment. And now they pay, most of them pay the medical treatment. But they didn't, for a long time, they did not. So the American Optometric Association has tried to help educate optometrists, but also has really been quite involved in helping change legislation or to come out against certain things. For example, there was a company here that was doing online refraction. You could do your refraction right on the computer. And the American Optometric Association pushed to say that, you know, because eye health wasn't being checked, that it wasn't completely safe. And the company had to withdraw the refraction test from their platform. I think they're trying to bring it back. I think that COVID may make it easier for them to bring it back. But in fact, I spoke with them last week a little bit about that. But right now they can do refraction in other places. I don't know if you have it there. I know they do it in India. It's called, here it was called Alternative, and then they had to they changed their name here to Visibly. So I don't know what it's called overseas, but I think there's a lot of things we're doing. What they call telehealth here wasn't very popular, and in most cases you couldn't get paid for telehealth. Now with COVID, everybody's getting paid for it. They've required, Medicare came out first and said they'll pay us, and they weren't paying very much, and the doctors complained, and so now they're paying more like in your office. And most of the other insurances have had to come along and say, yes, we'll pay for those visits, because people are trying to do more.
Hello.
Yeah.
Okay. Thank you very much. Ma'am.
Yep.
Hello.
We're good.
You understand? Okay. My line is okay.
Yeah.
My network is okay. Okay. Some Wi-Fi problem. Okay, you run, madam.
Are we going to have to rejoin?
Yeah.
Okay.
Okay, ma'am. Continue.
Are there more questions? Anyone else have a question? You have to unmute to ask.
Excuse me. Good morning, ma'am. I'm Neeraj Dev Joshi from Nepal. Please don't. I'm coming.
Yeah.
I'm from Nepal and the president of Nepalese Association of Optometrists. By saying laser, does it mean the LASIK surgery or the medical retina treatment?
Say that again.
you said that you optometrists were able to do the lasers in USA.
In some states, only like 2 out of the 50 states.
So does that mean LASIK surgery or the retinal?
No, I don't think so. I'm not completely familiar with everything they're allowed to do, but I think what I'd heard initially was they were doing things like when you treat someone after cataract surgery that needs laser.
That is
And I think it's an opening for them to do other surgery. They don't do LASIK right now. They don't do retinal surgery where you might use laser. But I think it's just an opening for them to be able to do more things over time. And maybe they're thinking also that lasers will be used other ways. So it just gives them an opportunity to do more than they currently can do. But it's only because here those laws are changing state by state. It'll be a while till everyone can do that.
Okay, thank you, ma'am. Time is very short. Thank you very much.
Thank you for the opportunity.
Yeah, listen me.
Yeah, I can hear you.
Yeah, thank you very much. Our participant, thank you very much. We go to our main program. Welcome all the guests, member and Asian optometrists in this webinar meeting. Now our honorable President of Bangladesh Association for Optometrists will preside over the meeting. I request Mr. Monirul Jaman, please.
Hello. I have the honor to welcome every participant in the meeting of Asian Optometrists. Honorable our chief guest and founder advisor of Bangladesh Association for Optometrists, Professor Dr. Hassan Sahib Sir. Keynote presenter and special guest, Dr. K3 Guest of honor, Mr. Rajiv Prasad, India, Ranadev Banerjee, India, Montu Akon, India, Rajesh Singh, India, Sanjay Kumar Das, India, Mr. Naresh Pradhan, Sri Lanka, Mr. Neeraj Dev Joshi, Nepal, Mr. Vinesh Gautam, Nepal, Mr. Sarkar Subedi, Jiolin Lee, South Korea, and Mr. Salahuddin Singh, Head of the Optometric Department, University of South Asia. Also, Excellencies, ladies and gentlemen, now I request Mr. Ali Ahad, Secretary General BOA, to conduct this meeting.
Thank you very much, Mr. Monirul Jaman. Our network problem is very big problem. Thank you, our keynote presenter, Dr. Kathy Strait, his valuable speech. I request to all optometrists to introduce yourself. First is now Indian optometrist. I say Rajiv Da is now starting.
Thank you, Ali. Hi, everyone. Good evening from India. This is Rajiv Prasad, practicing here in the eastern part of India. I represent Indian Optometry Association. I'm the General Secretary of Indian Optometry Association. So thank you for having me, Ali. Thank you.
And next one. Please, Ranodevda, you use.
Hello, everyone. I'm Dr. Ranadev Banerjee from India, and I'm currently working with one of the leading lens manufacturing companies as their training head, a global training head. And as I have been requested by Mr. Ali, I would like to just put forth a few tips which you might be requiring in post-COVID situation or even now. Obviously, to maintain your sanity, having a lot of sanitization is a must. That's obvious. But aside to that, post-COVID situation, we might see an upsurge in myopia and also certain cases of computer vision syndrome, because people in this lockdown situation are doing a lot of near work, and this is quite evident. So we have to be very careful while treating this. For those people who needs to do certain kinds of ophthalmoscopy, try to have an usage of indirect ophthalmoscope instead of a direct one. Otherwise, you might get contaminated. And in case you come across cases of conjunctivitis, with or without certain symptoms of please do refer the patient to the appropriate medical authority, because certain cases are being coming forward wherein probably conjunctivitis could be a precursor of COVID infection. Aside to this, it's very important that for those patients who are coming purely asymptomatic, a recommendation of adequate protective eyeglasses should be important, because certain studies are coming up which are saying that about 37% of COVID infestation may happen through the eyes. So people who are just wearing masks or gloves, it might not be adequate. So please take care of yourself, your patients and your family, and have adequate protection. Thank you very much. Thanks everyone.
Thank you very much, all everything. On behalf of Asian activities, I am starting this discussion today by expressing my condolence to all the victims of Super Cyclone Amphan. I am also affected. My network is first time is my network is problem. Okay. Next one is now Subodh Kumar Dixit, President Indian Automobile Association. Is Subodh Kumar Dixit? Hello.
Hello. Hello. I'm audible.
Hello, Subodh.
Hello. I am audible.
Yes, sir, we can hear you. Please go ahead.
Subodh. Hello.
I audible. Hello.
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 Yes, you're audible, sir. Please continue.
Yeah. Myself, Subodh Dixit, President Indian Optometric Association. First of all, I welcome all of you. All these associations. This is very good initiative. And as our Secretary, General Secretary, Ajit Prasad is here. He look after all the matters, and we again say that India is the most developing country, and he is very near to form a legislation in the form of ASP bill. So just in few months or 6 or 7 months, after 6 or 7 months, we are in hand the legislation. And thanks for inviting us.
I asked to Mr. Professor Montua, you please self-introduce. Hello. Hello, Montua Konda. Hello. Hello. Excuse me. Montuda is there.
Next one, please.
Next one is now, please introduce, self-introduce, Naresh Pradhan, Program Director, Eye Care Institute, Colombo, Sri Lanka.
I'm here. I'm Naresh Pradhan from Sri Lanka. I'm a program director of ICA Institute, and in Sri Lanka, the things has been much better. So we have been starting working from last week. Now all the casualties has been, almost all the corona cases has been, almost controlled. We had almost 1,000 plus cases of corona, and then almost now 75% of the corona ill people has been returned back home, and new cases has been almost not found in a community level at all. And now whole country has been open, and step by step by next week schools are getting open. So everything in Sri Lanka looks perfectly fine, and the way the government has taken the step, the way the people has cooperated into this, and then especially when it comes to optometry point of view, when corona issue came to Sri Lanka in March, we had lockdown in March. And very initial thing what we thought was, the people could have been affected who are quarantined even, and people who are in front line, the armies, the doctors, nurses, and people who are in front line, they can have problem on their vision, especially their spectacles could break, their contact lens solution may go, they may finish with they may go shortage. So we had a direct communication with the head of the program, and we assure them whatever necessary for the frontline people, that eye care that is required, we will be providing them. And we provided them the instant reading glasses for their immediate need. And so then members of our organizations in the country, we had online numbers so that people can reach to us for their problem, the people who can get injured, so that they can be treated. So through WhatsApp, through the social media, we gave them advice over on a video calls like this. And we prescribe them medicines, we give them the instructions how to now somebody who is doing gardening, if they have injured their eyes, and sort of a thing, or if they have broken their arms, temples, and the of the spectacle, how to repair them, how to adjust them. And then certain places we have, we had a permission to go and do the services. And especially for the frontline people, the doctors, nurses, PHIs, public health inspectors, and these people who are in frontline. And we did our job to make sure that they are not out of the mission, right? So that is one thing, that optometrists at the moment, wherever the lockdown is taking place in the country, so that they can come forward and give their, from the social media, they can give their number to the public and give online support to the public, whatever they are, now they come up whatever different problem that they can come up. Second thing is the technical problems that they can have, we can sort it out. And especially the frontline people who are taking care of us to avoid COVID-19 for us. So we have to be also with them to support their vision. If without vision, those doctors, those nurses, those front team, they cannot function themselves. And I request you all in your countries, come forward and support those people, whoever in the front line, that they have problem. And the people who are quarantined for 3 weeks, so without glasses, they cannot go into they cannot manage to see their handphone, they cannot read newspapers, they cannot manage themselves. So come up with these things. Additional to that, before we started reopening our practice, we had again like this kind of a Zoom webinar, and we had several seminars to aware the optometrist how to handle the patients. We develop our own guideline, and then we distributed the guideline how to prepare their place, how to prepare their practice, how to avoid most of the unwanted thing, immediate unwanted things. from the showroom, from the clinical places, from these things, and how to sanitize themselves, how to intake the patient, how to reduce the crowd. Now when somebody comes, say number of patients coming in or the caretakers coming in, how to give them appointment. And if like our friend from India who has mentioned like conjunctivitis, especially follicular conjunctivitis, it is, and then if there is, all those documents need to be kept, because of in case if there is an issue, that we can reach to those people, those patients who has come to us. And those instructions been given. And so at the moment we are practicing ourselves. People are getting used to getting into the normal route. And so Sri Lanka is almost back to the normal. The optometry practice in Sri Lanka is getting back to the normal. The daily life of this country has come back to almost normal. It's a great thing, great message to give you all. And what we are doing here, so especially prepare the guideline for the optometrist. From now, we have to give some sessions for them, how to now especially sometimes not only patient, even our staff members can have a COVID-19, and we have, if we have not tested them, that could be a problem. So so all these things we can share with you all how we have prepared our guideline. And we have already shared with few of our friends. And especially at the moment, what we request you all is, on behalf of you, the doctors, nurses, PHIs, or armies, or police, whoever is functioning at the front line, so be gratitude to them. And your part of my part of job is to assure that their vision is in the right place, that they can see properly. And so if they have gone out of the way, and let's go out of the way and serve that, right? So that is what we have to give you the message from here, what we have done. Thank you very much.
Thank you very much, Noreza. You are artist of Bangladesh optometrist and Asian optometrist. I request to introduce Mr. Neeraj Doshi, President, Actors Association of Optometrists.
Mr. Aliyat, attention please. Sumona Alam, Abu Hanif, and Nipindro Da. Please, you
Next, you stop now. Next is Bangladesh. The option is they are introduced. Okay.
Earphone.
Yeah,
good evening here in Nepal, and thank you for the opportunity, Bangladesh Association of Optometrists. And we are in the second month of lockdown here in Nepal, and probably we'll have it lift up by the 10 more days, and people are getting settled, and they are like accepting the new normal. If you see the eye care practice currently in the country, the hospitals are running the eye care services with the maximum protection that is required, as eye care staffs and doctors are using the PPE. The patient are using masks and social distancing. There are initially, when we had multiple number of cases, there were conditions where the optometrist in the country and ophthalmologist in the country gave online and telephone consultation, say personally on the hospital basis. And as WHO is saying that COVID is here to stay, it may never go never. So the issue is that if it is going to stay for a longer time, how we need to develop a newer guidelines so that social distancing and personal protective equipment may be used by the doctors, say for the longer duration. And the difficulty in our case is that most of the eye care is community based, and we have to reach to the public, to the villages where we may not be able to continue the service in the same pace due to this COVID. So maybe we'll have to develop the guidelines how we are going to conduct the community eye care even after this COVID comes under control. And as you know, the WHO says that COVID is going to stay here for the longer time. I would like to add on something regarding the optometry practice in our country. If you see, optometry is in Nepal is a 4-year course after high school, that is +2, 12 years of schooling, and we are registered in the government council, and we are eligible to provide medical treatment along with the other optometry practice. And the challenge here in optometry practice is that we don't have an integrated eye care system within the government. And I would like to introduce Sanjeev Mishra sir, who is along with me here. He is the ex-president, and he would add on something. And he is the member of council, executive board member of the council. If you would give us 1 more minute.
I will ask you, please he introduce, please. Yes.
Good evening. Good evening.
Yeah, he has come online.
I am of the council of government body. Practicing
Excuse me. Sorry, interrupt. Please, everybody mute your.
I want to add.
It is very
Mr.
disturbing
Abu
sound.
Hanif, Nibindota, Aponais, Alom, please mute your earphone.
So we have a 4 years. And I am a program coordinator. So in Nepal, optometry course is 4 years academic in our institute. So we have the clinical practice as well as academic session from the initial year to first year to final year. And we have also the code member of Nepal Health Professional Council. We have a code of conduct. So how to practice the optometrist in Nepal. So we have a certain in government. So I think Neeraj sir has explained all the things. So this is my first meeting. So thank you.
Thank you very much. Thank you very much. I self-introduce our valuable person, our friend. Please self-introduce Jiang Lin Liu, Senior Optometrist, South Korea.
Hello, everyone. My name is Jung Lee. I live in South Korea. I'm Korean optometrist and work in optical center for 20 years. Now I teach teaching physiology and eye disease foundation as adjunct professor in Department of Optical Science in Daejeon University, Science and Technology. And I'm in PhD program. Nice to meet you all. I want to say today in Korea, coronavirus, how to respond to government and optical clinic or optical center. The response to the COVID-19 in Korea is going well, but it is still going on. Korea is suffering from human and economic damage from the COVID-19, but the Korean government is responding well to COVID-19. I think we are all known all over the world, and we are doing a model response. The basic philosophical concept of Korea growth response is justice. The idea of helping the most vulnerable person first, and the tendency of Korean society to value the interests of the community and over individual freedom. The rapid response of the Korea Center for Disease Control and Prevention and the establishment of the Foundation for High-Speed Internet have prevented the speed of infection. COVID-19 can be transmitted through the eye, nose, mouth, and so we should wear a mask, wash your hands, and keep physical distance. COVID-19 causes conjunctivitis in eye. Conjunctivitis is caused by various causes such as virus, allergy, and dry eye. So I can't say that the virus caused conjunctivitis, but according to the announce of the journal, conjunctivitis occurs. Therefore, it is recommended to wear glasses rather than contact lens. Then let me tell you how the optician eye department in South Korea responds. Korean opticians recommend wearing mask and disinfection hand before enter the optical shop and clinic, and recommend wearing glasses at prevent of COVID-19. Glasses are essential to avoid direct eye contact with the virus. Glasses have the effect of blocking this virus, dust, ultraviolet ray, and wind, adding the function of the light of reduce eye fatigue and prevent eye dryness. Because the wind does not cross directly to the eye. So the Korean Association of Opticians made a poster and distributed them to the Korea optometrists or download them so that they can be used in each optician shop and eye clinic center. And in coronavirus during period, every Korean optical center and eye clinic center open, normally live and normally live. So, but I cannot meet COVID-19 patients. So I known the knowledge for the internet or sometimes sometimes announced for the poster or study case. So nice to meet you in this meeting. So in Korea, optical system is two parts. First part, medical school. They enter to maybe 10 years study in medical school. Another part is optician or Korean optometrist is to special something because of course is short course is 2 years, another course is 3 years, and 4 years some people graduation postgraduate school. So many opticians in many opticians work in Korea, but various opticians they have skill. Okay, it's nice to meet you through the internet today. If you are a chance to come to Korea, please contact me. Thank you.
Thank you very much. Thank you very much. I asked Montu sir is here. Our Montu sir is here. And Sanjay Kumar Das, Indian President BUC is here. Please introduce.
Alia Ahad, introduce myself.
Yeah.
So.
No, thank you very much. Thank you very much. I found our Montu sir is here.
Yes.
Okay, next I say say self-introduce Bangladeshi optometrist. At first now Salahuddin Shum sir. Please Salahuddin Shum sir.
Sorry, I cannot understand your words.
Hello,
next time question the email or send message. I answer.
Okay.
I think Salahuddin Shuman sir absent here.
Salahuddin Shuman sir, please introduce yourself.
Mr. Ali Ahad.
I request to introduce. I request to introduce Mr. Moniruzzaman.
Salahuddin Shuman sir.
Bangladeshi optometrist. Please introduce Mr. Khalilur Rahman. Ask me. Hello. Mr. Khalilur Rahman, Vice President, Bangladesh Association for Optometrists. Your mode. Please next. Mr. Opi, you introduce. Mr. Opi. Mr. Opi. Mr. Opi, you introduce. Self-introduce, Mr. Opi.
Go to next, please.
Hello. I going to Mr. Khalilur Rahman. Khalilur Rahman is here me. Hello, excuse me.
বাংলাদেশি গুলো বাংলায় বলুক না।
হ্যাঁ, বাংলাদেশে যারা আছেন তারা একটু পরিচিত হন। বাংলাদেশে যারা আছেন তারা পরিচিত হন। ওপি আপনার সাউন্ডের মোড অন করে পরিচিত হন।
স্যার নিজের পরিচয় দেন।
Uh, my name is Obaidul Haq, OP, Optometrist, Bangladesh.
Next, Shomana. Shomana, you introduce self-introduce, please.
Good afternoon and good day to all. I am Shumona.
Next one.
Mr. Khalilur, Mr. Nazmul Haq, please introduce. Please introduce Mr. Nazmul Haq. Our Vice President, Mr. Nazmul Haq, please introduce. Self-introduce. Note your
ইংলিশে বলা দরকার কি বাংলায় বলুক না
নাজমুল সাহেব আপনি বাংলায় আপনার নাম আপনার ইয়া বলুন ইন্ট্রোডিউস হন আপনার সাউন্ডটা ইয়া করেন ঠিক করেন নাইম রাসেল ইউ ইন্ট্রোডিউস নাইম মাহমুদ ইউ ইন্ট্রোডিউস প্লিজ
I have completed my introduced at first time. I'm Naim Russell, Bangladesh optometrist, and good evening and somebody good morning. Hi.
And
We're
Mr.
fighting about.
Alamin, please. Okay, thank you very much. Mr. Alamin, please introduce.
Hi, dear sir and madam and my colleagues. Good afternoon. I am Muhammad Alamin and pediatric optometrist. I'm working with Bangladesh Association for Optometrists, office secretary. Thank you, everyone.
Thank you, Alamin. Please introduce Nipendranath Roy. Please introduce. Please self-introduce Atik Siddiqui.
Hello, everyone. Assalamu alaikum. Good afternoon. I am Atik Siddiqui from Bangladesh, optometrist, Bangladesh rural area. Nice to meet you to all. This meeting is very important, this situation. Nice to meet you to all. Thank you.
Please introduce Aksar Ahmed. Please introduce Aksar Ahmed. Network problem. I think that our network problem. I request to introduce our. Please, Shomona, you introduce our chief guest. Please, Shomona, you introduce our chief guest.
Hello? শুনতে পাচ্ছেন?
Yeah. Yes.
Good afternoon and good day to all. I am Shumona along with the author biography of our chief guest, Professor Dr. Hassan Shahid Sarardi. Professor Dr. Hassan Shahid is worked as Professor of Ophthalmology of Bangladesh Medical College. He has been working in ophthalmology since 1975 to date. He worked as founder, principal, cum head of the Department of Ophthalmology in Uttara Adhunik Medical College. He worked in different capacities in the Department of Ophthalmology in Arabian, West Europe, East European, African, and Asian countries. He is working as a Dean of Public Health and Science, University of South Asia. He attends seminars in America, England, Australia, Austria, China, Hong Kong, Africa, and India. He obtained following awards: FCPS Bangladesh, DORCS Ireland, MRC Ophthalmology London, FAMS Vienna. He is a member of American Academy of Ophthalmology. Mother Teresa Golden Award 2010, OSB Lifetime Achievement Award 2018. He holds position of a number of prestigious body. This includes Examiner of MBBS, DO, MCPS, MS, FCPS. He authored 8 books, more than 30 publications, 2 dissertations, and guide of many dissertations. His special interest is in optics and optometry. Professor Hassan Shahid is married to Dr. Shamsun Nahar and has 3 children. Shahnur Hassan, HCPS Ophthalmology, FRCS Glasgow. Dr. Sumaya Hassan, MPhil and MD Radiology. Dr. Samia Hassan, MD Physiology, BSMMU. His in-laws are Dr. Muhammad Bokhtiar Uddin, MS Urology. Dr. Shahnaz Begum, HCPS Ophthalmology. Dr. Tanveen Kamal, HCPS Final Part Neurosurgery. He is blessed by Almighty with grandchildren Dipto, Proggo, Shomo, Anusha, Protoy, and Protoy. Thank you.
Please, our chief guest, if you start our meeting, you speak valuable speech.
Thank you. So many things you have said. Well, now, respected Chairperson, Mr. Moniruzzaman, the President of Bangladesh Academy of Optometry, and the special guest, Dr. Kenny Speaker, Dr. Kathy Stern from USA. And I welcome the guest of honors, Dr. Ranode Banerjee from India, Rajiv Prasad, also from India, and Montu Akon from India, and Rajesh Singh from India, and nothing less than from our country is the finest teachers of the University of Optometry of South Asia, Mr. Salahuddin Shumot. And I'm going to hear also from Naraz, though she is from Nepal, and Binej Gautam also from Nepal, and Shubhesh also from Nepal and Sri Lanka, and Lee from South Korea. Well, I've been in all this country. I've been in South Korea too, marvelously good country, like it. I've been in Nepal too, good, and in Sri Lanka too. They are doing good things, and India is almost is my country. So I do have all the idea what they are doing. But here I feel deeply concerned and honored for your invitation as chief guest. I would love to be yours rather than a guest. I want to be one of yours. Respected participants, you did a marvelous and tremendous job collecting the leaders of optometrists of the South countries as well as the countries of the world. I want to mark this gathering with few points and few proposals. You, the participants, respected participants, have learned is the leader of optometrists of these countries. So my proposal is that can't you make an united effort so that you can help each other? My proposal that if you form an ad hoc committee in this meeting to form a combined society, it might perhaps be International Optometric Society. As a doctor, I do have International Small Incision Cataract Surgery Society. We do have APAO. So why you don't have IOS, International Optometric Society, which will include all the countries? My second is that if you like to do it, make a constitution and form a constitution like chairman. It may be from India, maybe from Nepal, maybe from Bangladesh, maybe from Sri Lanka, maybe from Korea. But they do it. But the chairman should be maybe from the largest country, India, vice president maybe from Nepal or Sri Lanka, secretary general maybe from Bangladesh, and the advisor maybe from America or other things. Why? The America and we people maybe the advisor too. But if people have to do the work, mainly the Indian, Bangladeshi, Sri Lankan, and Nepalese, the other could be the advisor. Well, with that, you can go ahead. And I, as a guest, chief guest, I would like to advise you, you could fix a name of your organization and go accordingly and do the job so that you can go ahead with the united efforts. Otherwise, you'll be dispersed and this will not work much. With this view, I thank you all. I feel obliged, privileged, and honored for your invitation. With these few words, I conclude. Thank you.
Thank you. Thank you very much, our founder advisor, Professor Hasan Shoaib Sarwardi sir. I, I request to Honorable Chairperson, Mr. Moniruzzaman, his speech, valuable speech. Mr. Moniruzzaman.
Honorable Chief Guest, special guest, and ladies and excellencies, ladies and gentlemen, I really feel honored today as a president of Bangladesh Association for Optometrists. We are today talk about COVID-19. Already your nice, valuable speech delivered here today. I really appreciate your attendance to this online meeting. Thank you all for your participation. I conclude the meeting with thanks. Assalamu alaikum.
Thank you. Walaikum assalam wa rahmatullah. Just finished.
Finish.
Thank you
Finish.
very much. I ask something. Our advisor and request the ad hoc committee or edition of topics. This topics I discussed with next time email and others. And I asked our keynote presenter, please you have to join as a advisor of Asian Optometrics Unity. Are you agree? Kathy, Dr. Kathy Strin.
Kathy here.
Yeah, I'm here.
Oh yeah. Kathy,
Now you
I'm
are
the. Oh, what? I'm Professor Hassan from Bangladesh. I've been in America too. I know if you join these people, they can be advised and go ahead. So please join with them, and I will be with you people too. Thank you.
I'm happy to help in any way that I can.
Thank you very much. I am extremely sorry. First time is internet problem and our cyclone problem is a very big problem. That meeting is something is now hazy. I pardon me, please. Thank you very much. I end of the meeting. Thank you everybody. Thank you every Asian country, Korea, America, and United Kingdom. All country members is thank you very much. I end of the meeting. Thank you very much.
Thank you. Thank you for the opportunity.
Thank you, Tay.
Thank
See
you
you
all.
again.
Thank you.
See you again.
Thank you very much.
See you again.